This is Dr. Ataur Rahman. Today's topic for discussion is hospital malnutrition. Malnutrition is a condition often referred as poor nutrition. Sometimes you may define it as a lack of nutrients, especially in terms of protein intake over time. It's a highly problematic emerging condition globally. It's a burden on providers, it's a burden and affect the quality of life of the patient, and it's challenging the healthcare system around the world. So current statistics reveal that 20 to 50% of the patients they are either they are malnourished or they are at risk of becoming malnourished during hospitalization. 54% likelihood of 30-day readmissions in those patients. They are three times at higher risk for developing pressure ulcer. 2 times they have higher risk for developing infection during hospitalization. So these conditions ultimately will increase the cost of the hospital, affect the quality of life of the patient. So these studies were conducted initially in the European countries or North American countries. So we thought in this part of the world, I mean the Asian countries or African countries, of course the situation is worse as a whole community. So, but there are no statistics, there are no studies available at a mega level. I mean intercontinental studies were lacking, so the data is missing. We want to develop or make a registry for baseline data for hospital malnourished nutrition in those patients in these regions. On the platform of science, we initiated this project. We want to study and get the statistics in line, and fresh statistics should be released so we can make or advise or recommend good strategies. So the studies have, why we want to study now, because there is increasing evidence, volume of evidence that is actually showing the 27% reduction in the hospital readmissions, significantly reductions in reductions in the percentage of infections, the 5 times likelihood of death of those patients who are malnourished. That will tremendously decrease. We can save the life of the patient when we address the hospital malnutrition. So to address it correctly in Asia, Africa, or Middle East, we need the statistics. So we have this study now, intercontinental study initiated by science, and we encourage everyone to participate from the hospitals. The dietitians have a role, physicians have a role, nurses, and the hospital administrators. When we want to address in future, after we have enough data and statistics, definitely the new policies will be shared, and to address the issue there will be more teams, more focus on nutrition services will improve in the hospitals. It will be taken seriously for the benefit of the patient, for the benefit of healthcare system. National cost that goes billions, exceed billions in some European countries and American to treat directly the malnutrition or the conditions which are affected with malnutrition. So as a whole, we can say we can improve the outcomes by addressing as a multidisciplinary team. All the accreditation bodies around the world, they have the benchmarks which include nutrition status. So getting our chances or likelihood of getting accreditation will improve when we address beside quality of the patient and the cost of the hospital managers. That will significantly improve. But we can face this challenge and eradicate malnutrition from the hospitals when we work together, when we work as a team. This is the way to go in future as a more successful healthcare providers. Thank you very much. I hope you will participate in this study wherever you are. We all have a role to play, and we can all work together to make it a success. Thank you very much.